University of Highlands and Islands, and we've been working on a project which is looking to harness the power of the outdoors to increase health and wellbeing. And specifically we've been looking at hospitals and other healthcare sites to see how we can engage stakeholders in actually using those spaces for health and wellbeing.
Fantastic. So what kind of practical things has that entailed from the healthcare users' perspective? What are they experiencing?
Absolutely. We've involved lots of different groups, so clinicians, patient representatives, local community residents as well. And through our work, we've developed an engagement process around a series of workshops and different types of mapping technique that we've displayed here today. And it's really placing stakeholders at the centre of a design process so that their own health and wellbeing goals are then represented in design of the green space and interventions within the green space. One of the nice examples, I think, is the cardiac rehabilitation group that we've worked with. And they've designed, along with the NHS, Forestry Commission and ourselves, the UK's first outdoor woodland rehabilitation scheme for cardiac patients. So it was quite a surprise for the clinicians that was actually what the cardiac patients wanted to do, but a nice outcome. So yeah.
So what does that look like? How is that? Is there evidence of how that's impacting the people who are using it?
Yeah, absolutely. One of the things that we did through the knowledge exchange process was to look at what was actually changing for the people who took part in the intervention. So we used mixed methods, we used some quantitative measures of health, and we saw changes in physical health, changes in mental health, so reductions in stress, for example. And we used a social return on investment framework to look at the value that was created. And we found that for every £1 that was invested, there was actually £4 worth of social value created. So if you're thinking about our intervention, our 5-week intervention of conservation rehab costs about £63 a day per person. If someone's in a cardiac ward, they're costing about £1,200 a day. So we worked with the NHS to see how that was actually preventative spend for them.
Fantastic. So what role have you taken this way?
What I'm doing is I'm taking the project further around Scotland. It was based, the phase before was based at Forth Valley, and what I'm doing is I'm taking it to one of our local hospitals in Inverness, one new healthcare site in Glasgow, another site in Falkirk, and one further south in Ayr.
And are you seeing different requirements from the patients in different areas?
Yeah, what we're finding in Glasgow, for example, is there's a process of getting the community involved. There's a new healthcare site, and what we're looking to do is really try and engage with the community on a far wider scale than just the immediate healthcare site. At Ayr, we're finding that there's particular requirement to work with patients who are mental health service users. So we're finding differences in terms of engaging with particular groups, in terms of information that they need, and at various different times.
So is the longer term plan, I don't know at what point you're at with your project, are you near the beginning or nearer the end, and is there a longer term plan of how you want to see this go forward? Are you looking to create a model that elsewhere can be used, or just a framework in which people can ask those questions?
Absolutely. I think going forward we've had a lot of support from the NHS in Scotland and the Forestry Commission Scotland, and I think the things that we've developed, like our toolkits and the different resources that we've managed to develop collaboratively with them, we're really now giving those over to people like clinicians, the environmental sector, voluntary groups, to say these are the resources that can support you to actually get involved and to look at this type of model of using hospital grounds. And it's really supported in Scotland through the Green Exercise Partnership, for example, who are looking at taking this approach to different types of healthcare sites.
So where can people go to find out more or contribute or take part?
Absolutely. Well, there's linked to all of our materials. You can download them in a PDF format from the University of the Highlands and Islands website, and also from the NHS Forth Valley website as well.
Fantastic. Thank you very much indeed. It's great. And you've got lots of maps here as well to show people how things have been changed. So that's fantastic.